Hi, my name is Nadine, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled School-Based Health Center and Asthma, Enhancing Care by Reducing Environmental Triggers. During today's presentation, we will learn how school-based health centers can more effectively manage asthma by reducing environmental triggers and discover best practices and tools. But before we begin, we have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Q&A icon located in your Zoom toolbar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the one you are viewing on your screen. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. When health and education come together, great things happen. And attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Now, I would like to introduce our presenters today. Ann Kelsey Lamb has been the Director of Regional Asthma Management and Prevention for 15 years. Ann provides overall strategic guidance in working towards the organization's vision and mission, ensuring a highly effective organization and innovative, successful programs aimed at reducing the burden of asthma. Molly Baldridge has over 15 years of health education and school-based health center experience, beginning when she was a young person working as a peer health educator for her high school, School-Based Health Center. Molly is a project director with the California School-Based Health Alliance. Betty Franco is with South Bay Family Health Center, Healthcare, a leading community clinic system and one of Los Angeles County's largest safety net providers. She oversees the Carson High School Wellness Center and the Gardena Clinic, and serves as the liaison between the clinic system and the Los Angeles Unified School District. Reginald Figgs is the Community Schools Coordinator at Greenwood Academy through the West Contra Costa YMCA. In his role, he coordinates all non-academic services provided by Greenwood Academy High School and provides direction over the school-based health center. Dale Atkins is the pediatric nurse practitioner for the Belmont Charter School. As clinical manager, Dale is also part-time clinical NP supervisor to all nurse practitioners serving the other 13 school-based health centers in the Education and Health School-Based Health Centers Network. Thank you, everyone. I will now turn it over to our presenters.
Hello, this is Ann Kelsey Lamb. Thank you all so much for joining us today. I'd like to start by just reviewing the webinar objectives and the agenda. At the conclusion of this webinar, we hope that each of you will be able to describe the importance of school-based health centers addressing environmental asthma triggers and some tools to support them. We'll be able to list model interventions conducted by school-based health centers across the country and we'll be able to describe 3 best practices for school-based health centers in addressing environmental asthma triggers. For today's agenda, I'm going to start with an overview of the importance of addressing environmental asthma triggers and tools to support you in doing so. And then we get to the good part. We're going to hear 3 stories from the field. 3 school-based health centers will share the story of what they did in conducting an environmental intervention and the impact that they saw. And then my colleague, Molly Baldridge from the California School-Based Health Alliance will share lessons learned and best practices, and we will conclude with time for questions and answers. We're going to start with a poll question to get a sense of how many of you have experience already in working on these issues. Nadine?
Has your school-based health center done anything to address environmental asthma triggers? Yes, we're thinking about it. No, or I don't work at a school-based health center, but I'm interested in this topic. So we're going to give everyone a few moments to answer the question, and then we'll continue with the webinar. Okay, so we have about 17% that says yes, their school-based health center has done something to address environmental asthma triggers. 25% says we're thinking about it. 15% has said no, and 44% said I do not work at a school-based health center, but I'm interested in the topic.
Great, thank you. Well, for the 25% of you that are thinking about this, I suspect that this webinar will be extremely useful to you, and for the others as well. We hope to convert some of those no's into yeses, and for the 44% of you that don't work in school-based health centers, I'm sure you'll be valuable partners to the school-based health centers in doing this work, as it really often does take a collaborative approach. So thank you for taking a moment to share that information. I suspect that most of you are already aware of what a significant public health issue asthma is, given that you're on this webinar. But to start with just a few basic facts, 7 million children in the U.S. have been diagnosed with asthma. It is the most common cause of disability among children and a leading cause of school absenteeism. Asthma affects children of all ages, races, and ethnic groups. However, it's a disease in which we see significant disparities. Asthma disproportionately affects minority children and children living below the national poverty line. On this graph, the yellow bars represent where we see the highest prevalence. Going from left to right, they are Black non-Hispanic, Puerto Rican, and people living 100% below the poverty line. So how do we reduce the burden of asthma and start to chip away at some of these disparities? I often feel lucky to be working on a public health issue that, while extremely prevalent, has some clear solutions. There is a great deal of evidence about what works, and there are clear national clinical guidelines. We should be able to achieve the goal of every child with asthma having well-controlled asthma. So on your screen are the 4 vital components that are included in the National Clinical Guidelines. The last 2, highlighted in red, are the ones to which patients are least likely to have consistent access, but they're just as vital. We know that even children with the best medically managed asthma will continue to suffer from asthma attacks if their home, school, and outdoor environments contain environmental asthma triggers. And this is where we see a great opportunity for school-based health centers. There are over 2,300 school-based health centers across the country, and 90% of them already have chronic disease management programs. We know that you're already leaders in the clinical management of asthma because research shows that school-based health center users are less likely to go to the emergency department or be hospitalized due to asthma, less likely to have asthma-related restricted activity days, and less likely to miss school as a result of asthma. We believe that school-based health centers are well positioned to also be leaders in the environmental management of asthma. You can leverage your role as a strong link between the school, student, and home. So, In partnership with the California School-Based Health Alliance, we at RAMP proposed to the U.S. Environmental Protection Agency to support a project to support the engagement of school-based health centers in environmental asthma interventions. We received a 3-year grant in 2014 and are happy to report on some of the progress today. So the work has included several components. We developed a guide on environmental asthma interventions. It includes numerous evidence-based interventions aimed at reducing exposure to environmental asthma triggers and describes how school-based health center staff can either lead, initiate, or otherwise support those interventions. We conducted trainings in several states, always in partnership with the School-Based Health Center Alliance in that state. We led 2 different year-long learning collaboratives of school-based health centers who each received a stipend to participate and implement a small-scale environmental asthma intervention. And we developed case studies to highlight some of the success stories that we hope will serve as models for others. The guide can be found on our website at the URL listed above there in red, and I want to tell you a bit about how to use it before we launch into the stories. So near the back of the guide is an at-a-glance document that lists 5 broad strategies with some specific activities listed under each. You can cut this page out on the dotted line and use it to help stimulate your thinking. It's a great tool to bring to a team meeting to generate ideas. And then you can dive into that particular section to go more in depth on how to get started. So the first strategy that we talk about is education. And on the left of your screen is the first page of the education section in the guide. This section includes links to a broad array of validated curricula that can be used for group education with students. It also links to such things as PowerPoint presentations for educating school staff and materials for educating parents. One of the successful projects done by a school-based health center in our learning collaborative focused on educating youth to teach their peers about asthma. And you'll get to hear more about that shortly. The second strategy we cover is case management. And this section describes ways that school-based health center staff can integrate environmental management into their existing case management strategies of facilitating services and advocating. So one great example is to link parents with smoking cessation services. The third strategy focuses on improving indoor air quality in schools. There are many things that school staff do each day to worsen or improve indoor air quality, often without even realizing it. Well-intentioned teachers may bring in air fresheners without realizing that they contain chemical irritants that worsen asthma. Or custodial staff might use bleach to make sure to kill all germs without realizing that it can trigger asthma attacks. School-based health center staff, as the health experts in the school community, can work with other school staff to identify environmental asthma triggers and provide tips on how to reduce them. One school-based health center in our learning collaborative did just that. She worked with teachers to identify sources of asthma triggers in their classrooms and then provided tips on reducing them. For example, she provided the tip of putting stuffed animals in the freezer to address the issue of dust mites to kindergarten teachers who often had stuffed animals around. The fourth strategy focuses on improving the student's home environment. This section talks about the importance of identifying any asthma home visiting programs in your community. These are programs often done by community health workers or others and are proven to be extremely effective at improving outcomes. So one strategy is simply to find out if there's one in your community and set up a referral system if so. But this section also provides links to materials and tips that you can provide to families to help them improve their home environment. One of the school-based health centers in our learning collaborative conducted an innovative project where she taught high school students how to conduct their own home environmental assessments. When they brought back the results, she worked with them to develop a plan of action and provided them with the tools they need, such as dust mite-proof mattress covers or asthma-friendly or cleaning products. The final strategy focuses on outdoor air quality. While it may seem at first that school-based health center staff can't address the problem of outdoor air pollution, there's actually a lot that you can do. This chapter provides links to programs that you can use to educate students and families about outdoor air quality and ways that health providers can support advocacy efforts for policy change. One school-based health center and our learning collaborative worked with bus drivers to reduce their idling outside of the school. And that brings us to our school-based health center presenters. I'd like to turn this over to our first presenter, Betty Franco from the South Bay Family Health Center.
Hi, everyone. This is Betty Franco. I'm with South Bay Family Healthcare. Like they said earlier, I work with the Carson High School School-Based Health Center. We're actually in collaboration with LAUSD, so we're the medical provider of the facility. So basically what we did is we started this asthma work with the California School-Based Health Center Learning Collaborative, and we're starting to bring in students from the campus to do asthma teaching and screenings. And we started noticing that there was a smell in the clinic. And upon further investigation, we realized it was that the school buses were actually parked behind our wellness center, and some of the fumes were coming into the clinic. So we're like, okay, we're going to bring students in and into an environment that has something that triggers their asthma. So what we did is we got together and we kind of went out and talked to the school bus drivers to see, okay, what's happening? Is idling what we are getting into our clinic, the fumes from the idling? So we talked to them, became friends with them, and did a very short questionnaire. I think it was 4 or 5 questions. And basically, it asked them, do you idle? What are some of the reasons why if you idle, would you idle while picking up the children? What do you do? What makes you keep your bus on? Things like that. So they were very open to answering our questions. And so we came back and we realized that at certain times there was idling happening back there, mostly on really, really hot days or really, really cold days. And so they were trying, because most of these bus drivers move children with special needs, they're trying to make the bus comfortable for them. So they came into not a very hot bus or not a very cold bus. So we talked about that. So we said, okay, well, let's bring them in and talk to them about asthma and how the idling affects the environment and the children that are around the buses. So we again said, how likely or how open are you to coming into the clinic and meeting with us to look at our clinic, see our staff, and then we took the opportunity to talk about asthma. So they were very open. We had one person in particular who helped with motivating the bus drivers to come in, to one, to fill out the questionnaire, and 2, to come in and meet us. We got about 4, maybe 5 bus drivers to come in. We had refreshments for them. We had an asthma nurse from the district come in and talk about, okay, what is asthma? Just very general, what is asthma? What are the causes of idling on the environment? And it was a really, really positive outcome. They were very interested in the topic. They were asking questions. They were asking questions, personal questions about, okay, my grandchild has asthma, what should I do? And then we also talked, they didn't realize what the effects of the idling. They did it, for a good cause to keep their children comfortable, but didn't realize the effects that could have been caused to those same children. So after that, we offered them to come in. So like on those really hot days and on those really cold days, if they didn't want to sit in a cold bus or a really hot one, we offered them to come into our clinic, hang out in the waiting room, come in and get water, come and use the restroom, just, become very friendly with them. And they did. So when on those really hot days, they'd all come in, 3 or 4 bus drivers. They sit in our waiting room, talk, take a break, and then when they were ready to pick up their children, they would go back out and meet the children. I was trying to put up my thing. So that's basically what we did, and it was very positive. We got them engaged. Lessons learned, though, because we're on a school and we are partnering with the school district, it's really important to run your work through them because we do it innocently, but I guess, something came up out of it that maybe there were some violations. I don't know what the violations were. And of course, Eileen is a big violation because there is a policy. So we know now to pull our work and get the approval from the district to pull in their employees, even though it was a very general, very like meet and greet kind of thing. That's one of the lessons we learned. But the effects on it is that they didn't idle anymore. They didn't have to stay in the hot bus. They could come into our clinic and keep cool. And we stopped getting that smell into our clinic. So that was something very minimal that we did, but that had an impact where we didn't have the fumes coming in to our clinic.
Great. Thank you, Betty. Thank you so much for sharing that story. I think that's an important lesson learned that you shared. And I love this story because it's such a great example of the value of unique partnerships and the unique role that school-based health center staff had in developing those partnerships. I'm now going to turn it over to Reginald Figgs with the Greenwood Academy Health and Wellness Center. Reginald, are you there? We can't hear you. You may be on mute.
Hello?
Now we can hear you. Thank you. Yes,
okay,
now
no
we can
problem.
hear you.
It was exciting to hear about her program a little more. I heard about it before. It was exciting to know that the work goes on all over the place. Just a little background about Greenwood Academy Health and Wellness Center. We are actually a school-based health center that's based at a continuation school. So we have a lot of high trauma at our high school, and it's always exciting for us to get new programs and get new funding to provide more youth education. One of the things that we do with programs similar to this is we immediately set up a new group, or we create a working group out of the grant or whatever measurables we're trying to reach. And with asthma, it really hit home for me because I have a wife with chronic asthma who spent a lot of time in the hospital. We live in the shadow of an oil refinery, and our area in particular has a very high amount of asthma suffering children. I wanted to start by telling a story about one of our students. We'll call her Grace Kelly for confidentiality. She's a student at Greenwood Academy, and she was a member of our youth advisory board. Grace identifies herself as an African-American female. She's about 17 years old, and she's in the 11th grade. Just to give you a little background, she's experienced quite a bit of trauma in her life. Her father was incarcerated for 8 years of her life, and her mother will be incarcerated for her entire life. And living with a host of different relatives and being raised by other families, she's at her most stable point now living with her grandmother. So that's give you a background of the students that we have at Greenwood that we try to give these youth opportunities to. Now that she's a member of our youth advisory board, she's tasked with informing all of our students about the different projects on our campus. She's also asked to participate with us on the Asthma Collaborative to learn more about this program. She has several family members that have been diagnosed with asthma-related breathing complications, and she will always just use her inhaler when she had an attack. There wasn't much thought put into analyzing triggers. So that was exciting for us to know that we have asthma suffering students, but they don't know how to protect themselves from the different triggers. So by having preventive education was the most responding, we had a survey, and a lot of the teachers and the students wanted more preventive education. This survey was developed by some of our Kaiser interns, and also with the information about asthma. So what we did was we set up a series of workshops there was 3 specific trainings on prevention of asthma attacks and identifying triggers in the home and in our community. These were all hosted by some of our Kaiser interns as well as our lifelong medical providers. Students were then tasked with sharing this information with the students of 2 elementary schools in our area. Unfortunately, we were only able to get 1, but we were able to give a lot of information to that elementary school. In Grace's case, she was able to receive mattress covers for herself and her sister. She was also able to convince her grandmother to smoke outside, and that was very, very difficult. And we consider this one of the biggest takeaways from the entire project. One great way to implement this work in your school-based health center is by creating a youth group, and then leverage your partners to support for technical support. By using Kaiser and also using our school-based health center technical assistants to give us more information, we learned about new safer treatments. We learned of different steroids other than prednisone, which has horrible side effects. This is very important to us because we live in the shadow of a very busy and productive oil refinery. Major freeways zigzag through our neighborhood, and the number of children diagnosed with asthma each year is so high. It was important for us to team up with one of our most prominent health providers in our area to get technical knowledge about the triggers and follow up with training the youngest among us. I think teaching our high school students and then introducing that information to our elementary students by high school students, we can create kind of a rubber band of information effect in our community. The prevalence of asthma and childhood asthma in Richmond is 17%, which is more than double the national average, but it's only 2 percentage points higher than the California state average. So our state as a whole has a lot of students that are suffering with asthma. Through this work, we were able to go in our community and share this information. With a little funding and time, we look to make the most impact by having our peer leaders teach this information. So instead of training 15 high school students on the information and then having them give out information to their students, we were able to reach an additional 100 students through this work, and we will try to make it a part of our youth health pathway that'll begin this school year. Last year, we partnered with medical providers to provide spacers and pillowcases for our elementary students. And we also, one of the second biggest success we experienced was principals, teachers, and parents asking us to the program this year. So elementary schools in our neighborhood want the asthma information from our peer leaders for this new school year this year. So we're really excited about that work.
That's great. Thank you so much for sharing that, Reginald. I just love the way that school-based health centers have been real leaders in youth engagement, and I think that this is a great model of that. So thank you so much for sharing. Our next speaker is Dale Ayton, coming to you from Education and Health's Belmont School-Based Health Center.
Yes, good afternoon. I'm actually talking about a student from another school today, which is, the school is St. James. It's an independent Episcopal school in Philadelphia. There's a high level of family and community engagement and school commitment to the community at this school. And the school provides scholarships to children living below the poverty level in the context of an under-resourced community area. And last year, they first incorporated school-based health center services. So when I came into the school, one of the children identified by my asthma assessment process was Amari, and he's a 5th grade student, 10 years old, African-American, whose primary caregiver is his grandmother. There's some involvement of his mom and some shared custody. He's in the 5th grade. He'll be in the 6th grade this year. He was identified when teachers alerted me that he was using his albuterol inhaler several times a week after outdoor play, and in fact, he came to the nurse's office with pretty severe asthma symptoms, wheezing, coughing, short of breath. He had a high degree of allergic rhinitis going with it. He was using his Ventolin inhaler mostly. He did have a corticosteroid inhaler, which he had less of an understanding of and did not routinely use. And he was well able to name his asthma triggers, particularly outdoor and many indoor, some at home. So although he was very fluent in knowing what his triggers were, his management was not as good. Let's see, getting a little lost. His grandmother jumped right on board to get involved with him and take care of the situation at home, and they developed a system of looking at their home triggers and controlling those. I'll get into more of what the school did later. We did start a school-based asthma trigger management program and sent information home to the parents. Home visits were offered to assist in home trigger reduction and management. This year, the health center will be visiting homes of asthmatics and actually one-on-one rather than referring to an outside agency to do asthma education. Each asthmatic student at the school was interviewed to identify their symptoms, identify their triggers, learn how to reduce triggers, recognize symptoms, and report triggers that they encountered outdoors and indoors in the school. Amari's asthma improved significantly. He was able to incorporate the use of his inhaler. His grandmother and he were really adherent to the plan, very accepting and eager to gain educational information about self-management. And because of their enthusiasm, they were so effective that Amari might be used this year as somebody who can actually counsel other students on the ins and outs of personal asthma management, what to watch for, what to do as an assistant to the health service. Currently, what the school is doing is that there is no smoking allowed on the grounds. They implemented last year outdoor signs to discourage idling of motors throughout the day. We looked at issues of perfumes and scented markers and discouraged those. The school does not use any chalk. Cleaning solutions are being evaluated to consider their environmental impact and potential asthma trigger characteristics. Their rugs are not used in the classroom. There's a wet mop approach to cleaning up dust in the building now. Clutter is discouraged to avoid the dust collection, and the grounds are kept mowed and raked, decreasing the leaf and mold triggers that we found so problematic outside. So some of our challenges or successes. The challenges in Philadelphia urban community are considerable. There are a lot of asthma environmental triggers here, a lot of industry, again, the oil refineries, massive traffic and high-speed highways. It underscores the need for the detailed asthma education program, and incidentally, I found the Asthma Environmental Intervention Guide was so valuable in trying to approach program planning and problem identification in this process. Many of the asthmatics on school staff and their family benefited from the targeted asthma education programs. And I did use an approach of email contact to distribute some of this information to reduce the time costs to staff and administration of asthma education. The school-based health center was an ideal access point to provide close monitoring and individual assessment, and also that feedback and engagement with family members to help the family return to their PCP, follow their asthma action plan, understand their triggers, and implement a problem-solving process to reduce triggers. The school's enthusiastic support of the wellness programs was key to the level of staff involvement and asthma trigger awareness in the school. The tools and the leadership provided by the RAMP group and the School-Based Health Alliance provided the basis for successful approaches and resources to establish the asthma trigger education and remediation program. And as I mentioned before, Amari's grandmother and Amari himself were the force that really made an effective result in their case, improving his self-management skills. The reason this is so important for Philadelphia is that we have a high level of environmental asthma triggers, excuse me, significant air quality risks, in addition to indoor and home triggers. Impoverished populations in Philadelphia have been found to have higher incidences of asthma and other health concerns and comparatively lower rates of timely primary care. They tend to overuse emergency care centers, and this can be reduced by strengthening patient, family, and school knowledge and also the patient's self-management. Many of our families have transportation programs, other barriers to receiving care, and we just feel that school children learn best when they're empowered and supported towards wellness. So that's kind of the summation of our success story.
Thank you so much, Dale. It's a great example of how school-based health centers can simultaneously be providing direct service to influence a child and his family, and also working with the school on all of the policy and systems changes you described. So thank you for sharing that. And I will now turn it over to my colleague, Molly Baldridge from the California School-Based Health Alliance.
Great, thank you, Anne. Whew, that's a tough act to follow. I think we heard about some really amazing and inspiring work happening at 3 sites across the United States in communities that really need these types of interventions. And so I think what I'm going to do now is just go over some really important things that we've learned over the course of this project and these learning collaboratives, just to highlight and call out what you heard from our 3 examples and also the information that Anne has shared. So we know that 44% of you all are not at school-based health centers, but you want to learn more about this topic. So one of my roles at the California School-Based Health Alliance is letting everyone and anyone know how amazing school-based health centers are for school campuses, for their communities, and particularly that they are uniquely positioned to do this work on their school campuses. We really heard of some amazing examples of folks pushing beyond their clinic walls. So it's a school-based health center really provides that direct service, but as you heard from all these examples, these folks went beyond the clinic walls to build relationships with folks to really make changes in their school and communities. So because they're uniquely positioned, and as we saw displayed, you know, the folks who work at school-based health centers are really passionate and knowledgeable about health issues. And these folks in particular have really reached out around resources for asthma interventions and to address these issues. Additionally, school-based health centers, we've prioritized focusing on low-income communities and communities of color, as Reginald shared and Dale shared, you know, communities that have experienced high levels of trauma. School-based health centers can really address some of that work. And there's also a link between the child, the school, family, and clinic systems. Really, school-based health centers span that entire field. We're talking about parent intervention, access to that. We're talking about interventions with staff, working directly with the children, and then also having those clinical systems. And school-based health centers have more flexibility in working in schools as opposed to school staff, you know, the classroom time, getting access to those. And they're adept at doing more with less. So those of you who are at school-based health centers know that you stretch your time, your availability, really put in those after hours to be creative in solutions to problems. And we've heard examples of that. So kind of one of the other lessons that we really learned is a starting point is really important. And when we say an environmental assessment, we're not talking about school-wide screenings. We're really talking about doing an environmental assessment to see what the biggest issues are in your community. You know, identifying those target areas within the school or within the home or within the outdoor environment that are really important, and that's a great starting point. Something that most folks know who are in school-based health centers is how important it is to build those relationships with the school partners, having that key stakeholder on campus. So for example, what Betty shared around really finding that key stakeholder bus driver who was going to help elevate the work and recruit more of the staff to really be part of this learning collaborative and learn more about the effects of what they were doing. And a lot of the folks who are in school-based health centers know that the most important thing is listening to those key partners and getting buy-in early from folks. And I've talked to a lot of school-based health centers, and I experienced this myself when I was a health educator at a school-based health center, waiting outside office doors. Emails work sometimes, but not all the time. It's really about that individual face time on school campuses that we have learned is so important, and getting buy-in up front from those folks in these settings. And as I said before, really identifying a champion. I mean, young folks, especially in the high school school-based health centers, we've learned as a best practice, it can be some of our strongest champions on campuses to move this work forward. Not only are they passionate about these topics, but they can also get their parents or guardians to listen, which helps motivate school staff and community partners to get on board. And then finding that key stakeholder on your school campus is particularly important, who's really going to partner with you and knows that this is an important issue. And next slide, please. The next piece is really around creating sustainable strategies. I think folks are always thinking about sustainability now. And we've come up with a very short list of some things that folks can do. So buying supplies in bulk at discounted prices can really help. So when we're talking about cleaning products or any sort of educational tools, that can help. Additionally, we heard from Reginald and other folks in our Learning Collaborative have done this too, is utilizing volunteers and interns. So identifying local universities, local hospitals that need internship hours, so folks who can work for free, who can really help build capacity around education, but also help fill in some of that time to help address, any of the initiatives that we're doing. And then folks who are part of that 44%, identifying those partners who are in your community who are going to help move the work forward, who are already interested in this topic in particular, who are already addressing asthma in the community, who may be able to leverage funding to help support initiatives on campus. Also financing mechanisms and identifying local health payers who are particularly interested in funding this. So a local health plan may have asthma as one of their markers, and the California School-Based Health Alliance is working on this now. We're piloting some studies, so stay tuned. We've had some examples of this work with nutrition topics, and so we're particularly interested in seeing if asthma is another venue by which we can have health payers provide reimbursement mechanisms for all of this amazing prevention work that our school-based health centers are doing. And then finally, when we talk about sustainability, we have to talk about policy changes. And so when we say policy changes, we're talking about policy at a very local level at an actual school. So policies around bus idling and implementation of those policies, all the way up to larger policy implications within a school district, county, city, or state. And ensuring that we have kind of all of our homework done on the front end around health impacts to get folks really on board, and what a huge difference policy can make. And we know that when we talk about policy, we also need to focus on implementation, which Betty was really strong about, ensuring like this is a policy that's written here on paper, and how are we actually enforcing this or holding folks accountable to that policy. And the last thing I just wanted to highlight is that the first slide around school-based health centers is just so uniquely positioned. So if you want more information, we're really excited. These case studies are now live. We have 10 school-based health center case studies, and from what you heard of just a little glimpse into the 3 case studies, folks were really given the opportunity through this funding to do an approach that worked best for them in their community. So there is a wealth of information from these case studies. They're available on the RAMP website. We'll also be linking them on the California School-Based Health Alliance website, and National will be linking them as well. And as we said before, this webinar will be recorded. And I'm going to let Anne add any more about these case studies, but we're really excited. I know I love hearing stories from the school-based health centers directly, successes and challenges.
Yes, great. Thanks, Molly. Yes, I encourage everyone to check out these case studies because they really do reflect the diversity in the types of interventions that the school-based health centers and our learning collaboratives conducted, as well as the geographic diversity in where people are located and the types of communities and schools that they're working with. So I think all of you can find some inspiring story in there. And within those 10 case studies are 4 that we featured at the beginning of our project on doing this work. So they weren't part of our learning collaboratives, but they were some of the early leaders in already doing this work. And so you'll find those there as well. And on the screen now, we have our contact information for Molly and myself, and we can also, of course, get you in touch with the 3 school-based health center speakers who joined us today. But I would now like to turn it back to the National School-Based Health Alliance to facilitate the process of Q&A.
So while we give everyone an opportunity to answer questions, we have a few announcements. So while you're entering your questions, I do want to give you a little bit information about our membership. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based healthcare. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit our website using the link on your screen for more information and to join. We would also like to announce our back to school reminders. Let's talk data. You can now complete your National School-Based Health Care Census and report the National School-Based Health Center performance measures through our census portal. Please take time to get more information on our website and enter your data today. Also, beginning Monday, September 18th, you can submit your abstract for our 2018 National School-Based Healthcare Convention. Our 2018 convention will take place on June 24th through the 27th in Indianapolis, Indiana. Please save the date and we look forward to seeing you there. Okay. Now we would like to ask our presenters a few questions. So we have someone that asked, what cleaning supplies do you recommend? We have found many of our natural cleaners are plant-based and are also problematic.
Great. That's a great question, and I saw it in advance, so I could turn to page 58 of the guide that I'm holding up here. In the back of the guide is a list of resources on the different topics within the guide, and there is a section of resources called Tools on Asthma-Friendlier Cleaning Products. But basically, there are 2 organizations that review the contents of different cleaning materials and provide lists of them. And those are Green Seal and Ecologo, and their websites are both listed in here. But I also suggest checking out a number of tools that you can find in here. The California School Environmental Health and Asthma Collaborative did a quick video that you can watch on this topic. And then the State Health Department in California did a Healthy Cleaning and Asthma Safe for Schools, a how-to guide, which is a really wonderful step-by-step process. So rather than giving you specific names of products, we want to help you go through all the right steps to implement this kind of change. And these tools will help you do that on page 58 of the guide.
Okay. And now we have a few questions for our attendees.
And while you're answering these evaluation questions,
please feel free to enter any questions that you may have for our presenters into the Q&A box or in the chat box. And also, we'd like to remind you that this webinar is being recorded and will be available to you after the presentation. Okay, well, if there are no more questions, I would like to thank our presenters, Ann, Molly, Dale, Betty, and Reginald for joining us today. And if you all would like to communicate offline with our presenters, feel free to do that. Reach out to Ann or Molly with your questions. Thank you all for joining us, and I hope that you all will have a great day. If you have any questions for us, at the School-Based Health Alliance, please feel free to reach us at info@sbhforall.org. Thank you all.
Thank you.
We're going to get the water on the second floor.